Welcome to Jaw Talk, the podcast where we break down everything about oral and maxillofacial surgery, what it is, why it matters, and the incredible things oral surgeons do. I'm Aaliyah.
And I'm Emiko, and whether you're curious about wisdom teeth, jaw surgery, or dental implants, we're here to explain it all.
So, Emiko, let's start with the basics. What exactly do oral surgeons do?
Great question. Oral surgeons, also known as maxillofacial surgeons, specialize in diagnosing and treating conditions related to the mouth, jaw, and face. Their work includes a wide range of procedures, everything from simple tooth extractions to complex jaw surgeries.
That's quite the scope.
Absolutely. For example, they handle wisdom teeth removal, which is super common, but they also perform jaw realignments, treat facial trauma, and even repair cleft lips and palates.
Not to mention placing dental implants or diagnosing oral diseases like cysts and tumors. They're the go-to experts for both functionality and aesthetics when it comes to your face and mouth.
Speaking of wisdom teeth, let's talk about why these pesky molars are such a big deal.
Sure, wisdom teeth or third molars are the last set of teeth to emerge, usually between the ages 17 and 25, but for many people, there's just not enough room in the jaw to accommodate them properly.
And that can lead to problems like impacted teeth, infection, or even cyst formations. In some cases, they can crowd teeth, which might mess up orthodontic work.
Removing them early is often the best option, especially for younger patients whose roots aren't fully formed yet. But Miko, there are risks too, right?
Definitely. Common complications include dry socket, nerve damage, or sinus issues for upper wisdom teeth. But with proper care and an experienced surgeon, most patients recover smoothly.
Next up, let's talk about jaw surgery, also known as orthognathic surgery. This one fascinates me because it's a mix of medicine and art.
Totally. Orthognathic surgery involves repositioning the upper or lower jaw to correct alignment issues. It can address problems like severe overbites, underbites, or facial asymmetry.
And it's not all just about looks. The surgery improves chewing, speaking, and even breathing for people with conditions like sleep apnea.
True, but it's a big commitment. Recovery can take weeks or even months, and there are risks like nerve damage or jaw relapse.
Typically, an oral surgeon will work with your orthodontist to develop a treatment plan. Sometimes aligning your teeth with braces or retainers may be necessary to prepare your mouth for surgery.
Once the orthodontist gives the all clear and the patient's teeth are optimally aligned and prepared for corrective jaw surgery, the patient will schedule a pre-surgical appointment with the surgeon. At this visit, they'll take comprehensive facial x-rays and use computer video imaging to create a virtual model of the patient's teeth and facial skeleton in order to minimize treatment times, decrease the recovery period, and improve the surgery's overall efficiency and accuracy.
On the day of your surgery, you will be administered anesthesia to increase the comfort and safety of the procedure. After administering the anesthesia, your surgeon will reposition your jaw to suit your needs. Depending on your treatment plan, your doctor may add, reshape, or remove the bone. Your surgeon may also use screws, surgical plates, rubber bands, and wires to secure your jaw in their new locations. In most cases, incisions are made inside your mouth to reduce noticeable scarring.
After your surgery, you will likely experience facial swelling, bruising, and soreness. Facial swelling will peak around day 2 and 3 and continue to subside within the first few weeks of your recovery. To minimize the swelling, it's recommended that you apply ice packs in intervals of 20 minutes on and off, and that you keep your head elevated. You can expect your discomfort to improve with each passing week.
After about 1 week of recovery, you will meet with your surgeon for a follow-up assessment that examines how your jaw is healing. Still, the benefits like better function and a more balanced appearance are life-changing for many patients. Now for our special guest, our class president, Karenika.
Now let's talk about one of the most innovative solutions in oral surgery, dental implants.
Yes, dental implants are essentially artificial tooth roots made of titanium. They're surgically placed into a jawbone and eventually bond with the tooth, creating a strong foundation for a replacement.
They're a game changer for people who have lost teeth due to injury, decay, or gum disease. Plus, they look and feel natural.
And they're long-lasting too, often a lifetime solution with proper care. But they're not without risks, right?
Correct. There's a chance of infection, implant failure, or even sinus issues for upper implants. They're also more expensive than dentures or bridges, but the benefits often outweigh the costs.
So before a dental implant can happen, a few procedures might occur, and so one of these is bone grafting. So if the jawbone isn't strong enough to hold the implant, then a surgeon may have to add bone either from the patient's body, a donor, or synthetic material to make the jawbone strong enough to support the implant. And then the healing from a bone grafting can take 3 to 6 months before an implant can be placed. And then additionally, if the tooth being replaced is still in the patient's mouth, it may need to be removed first. But once those are all cleared, then the patient can have their first surgery, which is the implant placement. So the patient will receive an anesthetic, either local or general, so that they won't feel the pain. And then the surgeon will make a small cut into the patient's gums to expose the jawbone. And then a hole is drilled into the bone, and the implant, which is a titanium screw, is placed inside. The gums are then stitched back over the implant, and the healing for this can take 3 to 6 months until the implant is fused with the jawbone. This process is called osseointegration. And then once that's complete, you can move on to the second surgery, which is called the abutment placement. And this is when the surgeon will reopen your gums, and then a small connector piece called an abutment is attached to the implant, and the abutment is what will hold the artificial tooth. And then the gums are stitched around the abutment, but it'll stick slightly above the gum line. And this typically takes about 1 to 2 weeks to heal. And then once it's healed, the dentist will make a mold of your teeth and create a custom crown, which is the visible part of the tooth. And the crown is attached to the abutment. And the crown is designed to match the color and shape of your natural teeth so that it blends in seamlessly. And then after the procedure, swelling and minor pain and discomfort are normal.
Let's switch gears and talk about the tools oral surgeons use. It's like their own mini toolbox for the mouth.
Definitely. You've got elevators to loosen teeth, forceps to extract them, and bone files to smooth out any rough spots after surgery.
Don't forget surgical curettes for cleaning up tissue or wrong gears for cutting bone. And of course, there's the trusty scalpel for precise incisions.
Oh, and let's not leave out retractors and mouth props. These keep everything in place so the surgeon can see what they're doing and work comfortably.
Becoming an oral surgeon is no small feat. After dental school, you need to complete a hospital-based residency program.
And don't forget licensure. Most states require passing both written and practical exams. Plus, surgeons have to keep up with continuing education to maintain their certifications.
But the effort pays off. The average salary for an oral surgeon in Houston, for example, is around $324,000 per year.
That's impressive, and honestly, they earn every penny with the skill and precision their work requires.
Well, that's all for today's episode of Jaw Talk. We hope you learned something new and fascinating about the world of oral surgery.
And remember, whether it's wisdom teeth, jaw surgery, or dental implants, oral surgeons are here to keep your smile and your health on point.
Thanks for listening. We'll catch you next time.
Bye for now.